Did you know millions of people are trying to lower their blood pressure every day by reducing salt, taking medication, and exercising, but their blood pressure still isn't stable? The reason might not be because you're doing it wrong, but because you're overlooking a vital nutrient, and that nutrient is called potassium. Welcome to Smart Wellness Tips, where we share simple knowledge that can transform your health. In today's video, we'll explore why potassium is more important for blood pressure than you think, why most people are severely deficient in potassium, and how to supplement potassium correctly and safely. Without medication, watch until the end of the video, as the final part will help you apply this immediately in 7 days. 1. Why is potassium so important for blood pressure? Potassium and sodium. 2. Rivals in the body. To understand the role of potassium, we first need to understand the relationship between potassium and sodium. Sodium salt tends to retain water in the body. When the body retains more water, blood volume increases. Increased blood volume creates more pressure on the vessel walls. As a result, blood pressure rises. This is why eating salty foods over a long period often leads to high blood pressure. Conversely, potassium acts as a counterbalance to sodium. Potassium helps the kidneys flush out excess sodium through urine. When sodium decreases, the amount of excess water also decreases. Pressure on the blood vessels drops. From there, blood pressure is lowered naturally. Simply put, sodium retains water, potassium pushes water out. These two substances must always be balanced for blood pressure to remain stable. Blood pressure lowering effects equivalent to medication. One thing that surprises many people is getting enough potassium can help lower blood pressure as effectively as some prescription medications. Many studies show that in people with mild to moderate hypertension, when the amount of potassium in the diet is increased to recommended levels, both systolic and diastolic blood pressure decrease significantly. This reduction is equivalent to the effect of some low-dose blood pressure medications. The important thing is, potassium does not cause dependency. It does not burden the liver or kidneys if used correctly. And it brings many other benefits to the heart, muscles, and nervous system. Just reducing blood pressure by a few points makes a big difference. Many people think, what's the point of reducing blood pressure by just a few points? In reality, just reducing blood pressure by 5 to 10 mmHg brings immense benefits. Heart attack risk decreases by about 22%. Stroke risk decreases by up to 41%. These are very notable figures. This means just one small change in the diet, such as increasing potassium, can sharply reduce the risk of dangerous cardiovascular events. 2. Potassium deficiency. A common global problem. Most people only consume half of the required amount of potassium. According to nutritional statistics, the majority of adults only consume about 50% of the recommended daily potassium intake. The main cause comes from the modern diet. Current popular diets are often rich in processed foods, high in salt, sugar, and refined oils, low in green vegetables, fresh fruits, and legumes. Meanwhile, natural foods rich in potassium are consumed far too little. Many people don't even know they are deficient in potassium. The sodium-potassium ratio is reversed. An important principle in nutrition is the potassium-sodium ratio is more important than the absolute amount of each substance. In an ideal diet, the amount of potassium should be about 3 times higher than sodium. But current reality is the opposite. People often eat 2 to 3 times more sodium than potassium. This creates enormous pressure on the cardiovascular system and blood pressure. It is this imbalance, not just salt alone, that is the root cause of many hypertension cases. 3. How to supplement potassium most effectively. Why do doctors recommend supplementing through food? Many people think about taking a potassium pill for speed. However, doctors and nutritionists do not encourage the abuse of potassium supplements because each potassium pill usually contains a very small amount. It cannot provide the full 3,500 to 5,000 mg day. Taking a sudden high dose can cause heart rhythm disorders without a prescription. In contrast, potassium from natural foods is absorbed gradually, is safer, comes with many other beneficial nutrients like fiber, vitamins, and antioxidants. Potassium-rich foods you should eat regularly. Below are excellent natural sources of potassium. Avocado, rich in potassium. Heart-healthy fats, fatty fish, salmon, mackerel, both high in potassium and rich in omega-3 seconds. Potatoes and sweet potatoes, especially when eaten with the skin. Bananas, convenient, easy to eat. Dried fruits, raisins, dried apricots, should be eaten in moderation. Spinach, extremely rich in potassium. Legumes, lentils, soybeans, black beans. Small tips to increase potassium every day. You don't need to change your diet in a complex way. Just a few simple tips. Cook white rice together with lentils. Increases potassium and protein while still being easy to eat. Add spinach to smoothies. Doesn't change the flavor much, but increases nutritional value. Use baked potatoes or air-fried potatoes to replace packaged fries high in salt and bad oils. These small changes, if maintained every day, will create a big difference for your blood pressure. 4. How much potassium is needed every day? Official recommendations. World Health Organization. At least 3,500 milligrams of potassium per day. American Heart Association. About 4,700 to 5,000 milligrams per day. This number sounds high, but it's entirely achievable if you eat enough green vegetables. Add fruits. Prioritize natural foods instead of processed ones. Practical, easy to apply advice. You don't need to change everything at once. Try this simple way. For 7 consecutive days, add at least one potassium-rich food to every meal. For example, morning, banana, or a smoothie with green vegetables. Lunch, rice plus beans or fish. Evening, add sweet potato or spinach. After a week, measure your blood pressure again. Compare it with before. Listen to your body's feelings. Many people notice blood pressure is more stable, less fatigue, better sleep, less stress. Finally, potassium is not a miracle drug, but it is the forgotten key in blood pressure control. So don't just ask, have I eaten less salt yet? But also ask, have I eaten enough potassium yet? If you found this video helpful, please like, subscribe, and share so that smart wellness tips can help more people live healthier every day. See you in the next video.